Okay, Josh, we're live.
Awesome. Here we are live.
Another edition of Between Two Molars. I'm Trevor Maurer, my co-host, Dr. Josh Everts.
Good to see you, Trevor. Got a great guest on today.
Yes, yeah, we do.
Look at this guy.
Founding doctor at OMS 360, board member of OMS 360, and new president of Amos. So we have so much to talk to you about. I have a little bit of business to get out of the way, and then we're going to dig in with a conversation with you. Okay, Dr. Clark?
Okay, sounds good.
All right, excited to announce we have a new doctor starting next summer at Pittsburgh, PGH. So Dr. Powers signed his employment agreement, so that's fantastic.
Yeah, congratulations. That's awesome.
Really good. We had the office managers into Atlanta last week for an office manager summit. A lot of good training, learning, and collaboration. I was really excited to be there. But Dr. Everts, you're up in Amos. Maybe tell us what happened there, and then we'll segue to Bob. Dr. Clark.
Yeah, it was a great meeting up in DC. I think a lot of people commented on this is maybe the first meeting since COVID that it felt like an annual meeting again. A lot of people there, a lot of buzz, a lot of great exposure. The exhibitors fair went really well with all the team. A lot of great potential partner doctors visiting with us. We had a lot of great one-on-ones with them and group experiences. And then, Barake and I presented to the group about practice improvements. Probably had about 40, 50 people in the room for a very collaborative, very interactive discussion. Everybody had a great time. We got some great feedback from that. We are planning on presenting again next year, albeit pending an approval from Amos. So excited to do that.
Know anybody there?
Had a great time. Yeah, we got a few people there that we know.
I know
we might be able to get that past a guy. For those of you that missed it, it will be online. Your partner doctors have logins. The majority of them should be able to access that. And they have access to that, gosh, for the next 90 days, right, Bob? I think there's the virtual experience is available between now and the end of the year.
Yeah, it is. Yep. Till the end of the year.
Awesome. And more importantly, we congratulated Dr. Bob Clark on the beginning of his presidential reign this next year. So congratulations, Bob. I'd love to hear a little bit about what you've been working on and the experience so far.
Yeah, what does that mean?
Thanks. What, being president of Amos?
Yeah, what's your job? What do you need to do? What do you want to accomplish? What's your mandate for next year?
So before I answer that, let me just say that Marty Eichner and I came and we weren't able to see Barake and Dr. Everts, but we were there afterwards. And there was a large line of people talking to both of them that seemed like a lot of engagement, people that were really interested in what they had to say and seemed to think that the message they delivered was something worthwhile, and there was a lot of stimulation of thought. As far as my job, so my goals, Karen Wittich, our executive director, has a saying she tells every president: don't come here with an agenda because one will be given to you. And I got my first crisis on Friday before I'd even taken over. So, there's always something going on. But I kind of had three main goals. One of them is any oral surgeon understands this is preservation of our ability to provide outpatient anesthesia in our office. It's the thing that is constantly at risk, and we're constantly trying to solidify our privilege to do this. And we're in I think, a much better position than we've been in years past, but we just need to keep moving the ball along and continue to protect that. So that pretty much every Amos president, that's your first focus, because that's the thing that's always under siege. Second thing is revitalization of coding and business practices, coding, billing, reimbursement. The committee that I was on and Josh chaired is the committee at Amos that is in charge of this. And, this is the lifeblood of your practice. Anesthesia is kind of the thing that sets us apart from all the other dental and medical surgical specialties. But understanding the coding system and how to use it is essential to the profitability of your practice. So kind of improving that and improving the business offerings of the association is important to me. Not very sexy, but everybody
how we get paid
to do well. That's right. That's how we get paid. And if you don't think it's sexy, then maybe you should reconsider. But and then the third thing is over the past couple of years, we've had some disappointing results in our match, where some of the programs have gone unmatched. What we feel is an unacceptable number of programs. Ultimately, the spaces get filled, but they're not getting filled in the match on the first go round. Back when I was there, when I was going through, there weren't as many slots as there are now. Maybe there's 170 or 80, and there were about 400 or 500 applicants. And now there's about 1.2 applicants per position. And we're trying to get back to where we were before and trying to understand why that is, because we want to ensure that, the next generation that we're going to pass all this on to is the best and the brightest.
But Bob,
So
I think the majority of those unfilled spots are at 6-year MD programs. Is that right?
that's correct. There were 21 that did not match, and 20 were 20 were dual degree, and 1 was a single degree.
Yeah.
Bob, is there any thought around working with larger groups like ours in the doctor recruiting function, some kind of committee to help brainstorm around a solution there? Obviously, we'd be happy to contribute somehow with personnel or time.
I don't think that's been broached, but I think that's a great idea. There is a special committee Dave Morrison constituted last year that's, out of a number of educators, primarily at this point. But I think that, having the input of management service organizations and the what you see in the recruiting trail, I think is really important. Obviously, OMS 360 has been a tremendous recruiter into my practice, and we're doing something right. I think that leveraging some of that knowledge and manpower would be great.
Yeah, my perspective on that is, these recruiters, their full-time job is talking to these residents on, why did they enter the residency? What are they looking for? What do they want? So they may understand a lot more about the psyche than obviously the education. So anyway, food for thought. I hope that helps.
Yeah, and I think a lot of times maybe with the educator, there's a bit of a blind spot. They all have their biases. We all have our biases.
Sure.
I have some suppositions as to why I think this is occurring, but I don't have any data or facts to base anything on. But yeah, I think the recruiters would be a great source of information.
Is there anything your partner doctors here at OMS 360 can do to help Dr. Clark just in his mandate as president of AMIS? Like, how do you want us to support you?
I think that, for one thing, great ideas, which that one you had was a great idea right there. And bringing that to me, pointing out areas of maybe where there's deficiencies in AMIS, things that we're missing, things you think we're doing right. What you hear on the street where you practice about AMIS. What you hear from your colleagues, the people that come to AMIS, I hear from them, come to the meetings. The people that are engaged, I hear from. I'd love to know about the people that aren't engaged and why aren't they engaged? Because I used to get this comment, well, what does AMIS do for me? And it took me a few years, but eventually I figured out, I told them, how you sit in your office and you can provide anesthesia for your patients and you can make a lot of money? That's what AMIS does for you. It's not what we do for you. It's what hasn't been done to you that matters. Advocacy, certainly those efforts would help. And I don't know the partner doctors at OMS 360, if they became engaged at their state, local level or federal, come to the Day on the Hill and help with advocacy efforts, all those things would be beneficial.
The Day on the Hill annual meeting, maybe the December implant conference. Something that I want to, congratulate you on is Karin and Dana at AMIS are just exceptional to work with. Very, very helpful. We talk to a lot of surgeons outside of the AMIS meeting, right? That maybe don't go very often. And if there's anything that Karin or Dana wanted us to put in our reconnaissance, I'm sure we could add a few questions to the question list when we're doing diligence on a practice. So happy to do that too.
Yeah, that would be great. And Karin, Karin is an excellent executive director. Really, the whole team at AMIS is great. My time as treasurer, I got to work with Kim Molly. I used to call Kim Radar because we would be sitting in a meeting and she would slide this piece of paper over to me. 10, 15 seconds later, somebody would ask me the question. The answer was on that piece of paper. And I'm like, how do you do this? She's really good at making the treasurer look really smart because she's got all the answers and she's very good at anticipating where we're going. And most of the staff is like that. They're very dedicated. We had every year we have a thing with the staff where we celebrate anniversaries, and it's every 5 years. And this last year we had 3 35-year anniversaries and a 25-year anniversary.
Mm.
The only thing we didn't have was 5-year anniversaries because we didn't hire anybody in COVID. So, we had a year where no one was hired, so there were no 5 years. But we had 10, 15, the 25, and 3 35s. And, that's just incredible, loyalty to the association. Some of these people are very, well, it's like in your practice, you prize those people that have ownership, and these people have ownership.
So one more question. One's going to be hard hitting. I'll say two more questions. One hard hitting one for the end, and then softball for right now. Clearly, as president of Amos, you have to be careful of bias. You are part of a large group here at Amos 360. What would you say to the surgeon watching this video that's considering partnership? What's important for them to ponder?
So I think, the first thing I think is to put aside all the negative talk you may have heard from someone, and to realize that this is a practice modality that it's not going to make sense for everybody, but it is going to make sense to a lot of people. And it's not just the financial things. Certainly finances plays a part in it, but there's a lot of this, oh, you're this, that, and the other thing. Just the ease that comes to your life when you don't have to do all the administrative stuff, all the managerial stuff, the front end, the business stuff, the stuff that none of us get any training on and we're not any good at. Having all that taken away, having the ability to share best practices across a platform. The other day, one of the things I made was, our RCM team increased our rates with Delta Dental. It doesn't happen. Delta Dental doesn't increase anybody's rates. So those are huge things that you just can't do by yourself. And then, of course, obviously the recruiting piece was very important to us. And being able to recruit young surgeons who also want to be a part of OMS 360 and who want to invest in the platform and want to be a part of all this, and knowing that the legacy of your practice is going to continue, I think is also very important. Oh, now he's back.
Yeah, I lost me for a second. Josh, anything from you? I just had to move. Anything from you before I hit him with my hard-hitting question?
Well, the only thing I'd love to know, Bob, you are so plugged in and you're part of so many different things across our industry. Anything coming up this next year that you want our members to know about or think about or be prepared for?
I mean, the big thing that faces us right now is the issues with anesthesia and at the ADA, and they're redoing their resolutions at the ADA. The ADA is an organization that is in dire straits in their financial position, and I think it's important that we support the ADA. I don't agree with everything the ADA does, but they are kind of our parent organization in the dental profession, and I think we're stronger if the ADA is stronger. It's been a real shock to their system, but I think they have a lot of opportunity to move forward and to really strengthen their position as a doctor run rather than a staff run organization. And this is long overdue. That's probably one of the biggest things.
Interesting. Yeah.
The other thing, obviously, I mentioned, and this is going to be a multi-year fix, is what are we going to do about the resident recruitment and moving forward? But I don't expect we're going to have an answer and a solution to that in short order.
Well, I think that encourages all of us to also think through how are we connected to the dental schools, right? I think dental schools are inundated by periodontal programs and everybody but oral surgery. So, just as much as we're maybe visiting the residency programs, it'd probably be great for us to be talking to the dental students as well to promote our specialty.
I agree. And I mean, you've been in the District 3 caucus. I'm sure you've heard me chirping about this.
Yeah.
I've chirped about it forever, that, the oral surgery faculty who think that getting on the clinic floor and mixing with the students is beneath them, that dental alveolar surgery and implants is beneath them. That's wrong. That's the wrong way to think about these things. The periodontists are on the floor in the dental student space all the time. We need to be as engaged and we need to be as accessible as they are. And we need to, because these people are going to be referrals that, if you teach in an academic institution, you don't care. But for the 85-90% of us that go out in private practice, referrals are also the lifeblood. And you don't want them coming out with this negative view of oral surgeons as being some kind of, arrogant people that you can't work with.
Yeah,
So
that's
I
right.
agree 100%.
With respect to the time of these two very important doctors on this call, Dr. Clark, I have to remind you, as my friend, my business partner, and the president of the Association of the Greatest Profession in the World, be careful of your bias on this next answer. Try to hold your
boy.
emotion inside. We are around a week away from an SEC Classic, Kentucky at Georgia, and I'd like to hear your prediction of the score.
Oh, y'all gonna beat the dog out of us. You're gonna beat the dog out of us, as you have for many, many years. We did have a couple of years there where we kind of gave you a game for a half, or maybe even one year, I think we actually gave you a game for about 3/4.
2 years ago, you almost beat us in Athens.
Yeah. So, but I think, realistically, I'm going to put us at about, let's say it's going to be 53-7.
Oh,
Georgia.
man, I'm calling 21-17 Georgia.
Oh, wow.
You're being very generous.
We'll see.
Very generous.
Thanks for being on today. This is great.
Yeah, it's
So,
great. Thanks, Bob.
That's the 8 years at UK taught me to be realistic about the football team. Now we can talk later on when it comes to basketball, but in football, y'all gonna stomp us, and that's okay. My daughter went there, so I'm kind of a UGA fan as well.
True that.
Just like your twins. So
True that. Absolutely. Gentlemen, thank you so much for today. Congratulations again, Dr.
thank you.
Clark.
Thanks
Yeah,
a lot.
congrats.
Y'all have a good day.
See you guys.